Good day to the viewing and listening public. I'm Stacey Carmichael. This is the Progress Report, and today I'm joined by the Minister of Human Services and Social Security, the Honorable Dr. Vindhya Persaud. Minister Persaud, it's always a pleasure having you on the program.
Thank you very much, Stacey. It's wonderful to be here.
Now, today we want to talk a little bit about your ministry, the work that your ministry has been doing. Before we get into the deeper questions, my first question would be a brief recap of some of the projects, initiatives undertaken by your ministry since you've assumed the office.
Stacey, that's an excellent one in that when I got into office, I knew the ministry was extensive, but I did not realize the magnitude of what needed to be done in pretty much every sphere. So it required me familiarizing myself in a few days to determine what could be done in the shortest possible time, and how it could be done effectively. So it meant looking at institutions, systems, and also human resources. And in other words, looking to see what in the last quarter of the year we could budget to actually accomplish. So we started tackling the night shelter, and that project is still ongoing, where we are giving the entire place rehabilitative works, and we are adding on to that in that it never had a kitchen, so putting in a kitchen so that residents can have a hot meal. And the long-term works plan for that is to develop a soup kitchen on site so that people can benefit from at least one meal a day. So that's work in progress. It's also looking at the institutions that fall under the ministry and to ensure that they're effectively utilized. So the night shelter is a transition point. People who are on the street, people who are indigent, homeless, they can have somewhere to go, somewhere where they can be worked with, and those who are fit, again, going forward, all of these have been put in the pipeline. How do we work with them to get them back on their feet? And then moved over to the palms and looked at how the palms function and how we can effectively utilize the space, continue the refurbishment of the palms, which again is ongoing, looking at the state of the lifts, if we need more trolleys, stretchers, how we can properly care for those persons over 65 who are placed at the palms, and to improve services. That has also been started. Then moving over to the Mahaika Hospital, where numbers of persons with disabilities are housed, and involving children as well as seniors. So because there's so much space there, we're looking at upgrading the existing facilities, ensuring that persons with disabilities have a space. So it's developing that area going forward too into a disability complex, where it's not only a residential facility, but it's also a facility where we can train persons, they can be integrated into society, and they can really understand that there is care and compassion and consideration where they're concerned. And because of the interest in working with persons with disability, I've already engaged the Deaf Association of Guyana and a number of other agencies that deal with disabilities, including the National Disability Commission. And we have looked at, very early when I got in, I engaged the private sector, and I let them know that we need to start looking at employment for people who are differently able or people with disabilities. So they agreed to start thinking of ways they can employ persons with disabilities, also engage my colleagues from Cabinet to look in the public sector, how they can be employed, but not only employment at various levels, and also employment with equal pay. And because I understood too that training is a different and difficult thing for them to access, I did reach out to my Cabinet colleague, Premanik Chand, and we got the Coursera courses for the disability groups and shared that with the National Disability Commission, also the Deaf Association, so that people could have access to some certificates, because it's looking at those with disability in a very different way and ensuring that we not only understand their needs, but we respect them and we have a different attitude to them going forward that is more considerate. We also worked on PSAs with the Deaf Association and let them explain what their dreams were. I also learned a little bit of sign language during that process, and it made me realize how important it is to communicate with people in the way in which they feel comfortable, because many people do not access services because it's not delivered in a way that really appeals to them, or they're packaged in a way that, it is related to what they're suffering from. So that's where we're going to go in the future. We also looked at the Hugo Chavez Center, which is a big center, and there are numbers of persons housed there, but it was intended for drug rehabilitation. So I've done a full tour of that place. So it will be refurbished in the areas that need refurbishment, and it will be repurposed for drug rehabilitation. There's a mega program planned for that. I've spoken to my colleague, the Attorney General, and we are going to look at it in dealing with all the facets of drug rehabilitation, including the law and also rehabilitation in tandem. So we do take the whole issue of substance abuse very seriously, and that mushrooms out into a lot of other problems in our country. So it is taking a hands-on approach and dealing with that issue. Then there were a number of other programs outside of the institutions which I dealt with right away. I wanted to look at pensions. I am pushing for pensions to be increased, and from January next year that should be happening. Also looking at how pensions were delivered, and I would like to see more being put in place to make the elderly comfortable. So we looked at how we can improve where the pension booklets and books are being delivered. It's still a work in progress, changing the venues to better ones, more comfortable ones, looking at how we can reduce the long lines. In other words, coming up with alternative payment plans for pensioners where you can access your payment through the bank, or you can utilize other areas like MoneyGram, Western Union, those. So it's not only the post office, and ensuring that the long lines are again looked at, because it bothers me on a very deep level to see the elderly lining up and braving all the conditions. While we have started some of that work, I do know that much more needs to be done so that the whole system, you see, I'm very passionate about systems-based government and governance, I should say, because for persons to benefit, the systems have to work. So it's not going to be a quick fix, because it's looking at the resource, it's looking at reorganization, restructuring, as well as the persons who are utilizing our services. How are we catering for their special needs? And then a number of boards and commissions were put in place in this court, including the Adoption Board. We are trying to be in line with the Hague Convention. The legislation has been amended. The Attorney General's office has been working very closely with us, and soon that will be on the parliamentary agenda so we can have international adoptions happening. But adoptions are progressing because the board is now in place. We have also installed a National Family Commission, the Elderly Commission. The local Board of Guardians will be out quite soon. The Poor Law Commission is in place, and all of these commissions and boards are geared towards different target groups in society and working along with the ministry in different areas. The International Day of the Girl Child was a big one for us, and we focused on the girls, and the thrust of it was getting young women from across the country to share their perspectives and views on issues confronting them. So we engaged them on a very different platform where it was televised. I was actually part of that. We had young female moderators. Coming out of that, we are set to launch our Young Influencers program. Men were also looked at. We had the International Men's Day, and we did the same. We had some media personnel involved, and they were able to engage a number of men from across the country. We got a sense of what their needs were, and we are moving to the virtual men's hangout, safe online platforms for men to get expert advice and to unburden among their peers. So this is men only, no women. And this will roll out very early in the new year. We were hoping to it's ready to roll out, but we know people are going to be busy with the holidays, so we have put that for the new year. And it is, if you notice, we have pretty much focused on every group that falls under this ministry's mandate. And there's so many other things that happened, including the whole 16 days of activism, but I'm pretty sure you're going to ask me something about that, so I'll save that for then.
Okay then, thank you so much. You've said quite a lot, dear Minister.
Because we've been doing so much. The
yes.
days literally blend one into the other.
That's great. Before we move on, 914, that hotline was launched recently. Could you give us a little more details? Because I'm sure not everyone is totally clear on what's happening. What are the kind of assistance that they can get from that hotline?
Right. So the 16 days of activism this year was under the theme Orange the World. And the ministry, in addition to subscribing to that theme and oranging our building and trying to get orange everywhere, including on social media through our progressive social media campaign of awareness, came up with the tagline of enough with the violence, because I think every Guyanese, including myself, we've had enough with the violence. And one life lost is one life too many. So with that tagline, we started the social media campaign where we had the screens up and people could have been a part of the movement virtually. Then we moved it out into various communities by having community outreaches where we sensitize people about domestic violence, gender-based violence. And then we continue to do an aggressive, I would say, awareness campaign utilizing PSAs, edutainment, songs. And we launched a song recently featuring Poonam Singh and Abel Stokes, where we spoke about the impact of domestic violence. We did a little play on it, another dance on it. So all of these things, right, we're putting this in the minds of people. Because in the structured approach, education, awareness, and then we brought to the fore legislation, how it works and how it can protect you and how you can access the court system and the judicial system. What should you do if you find yourself in a vulnerable position? Then came what we would have been working on, the 914 launch, which was launched just recently. And we got together with a number of partners, including UNICEF. And I must thank them for being very committed to this process. Spotlight Initiative was also partnering with us, and GT&T and Digicel, along with the staff of the ministry. So 914 is out there. 914 is not going to be just another hotline. I know people say, well, if you call, problem is we might be frustrated. I want to say it's not going to be perfect at once, but we're working to perfection. So when you call, what can you access? You call, our operator answers you. If you're in a situation that is violent, we've reached out to the police force. We have developed a resource list of people from the police we can call to intervene right away. So it's not just calling the station. We're not doing that. And I must thank Deputy Commissioner Hickens for being so proactive and being a part of this. So the operator can call the police identified across the country. There will be a first responders team that would go to the person's home wherever the violent act is occurring. Then that will take its natural course of progression. Then there's the Survival Advocacy program that we've launched. That now will be the follow-on. If somebody needs counseling, somebody needs help in getting to the doctor, somebody needs help in getting to legal aid or getting through the court system, our advocates are now trained to walk them through that process. Then we've also started our cottage industry initiative, but I'll save that one so the person will also have access to that. So behind the 914, it's not just a hotline. All of these services from the ministry fall behind it. So if there is a report of trafficking in persons, you can call. If there is child abuse happening, you can call. If there's violence happening, domestic violence or any other violence, you can call. And the best thing is that it's toll-free, no charges.
Okay then, thank you very much, Minister. Now, while you were talking about the hotline, you mentioned the cottage industries. Tell us a little bit more about it.
This is very close to my heart, and this is understanding at the grassroots level. People may not have employment opportunities, and understanding too, at that level, there are difficulties perhaps with literacy, academic qualifications, training, and also perhaps not enough understanding of services and access to opportunities. So it's a holistic program. We started off with the Garment and Accessories Cottage Industry Initiative. And right away, over 200 persons from across the regions would have applied to be a part of this. All they had to do was to know how to make a face mask. That was it. So it was the simplest way to start. We partnered with the Ministry of Education, and we were able to supply almost 190,000 masks to get children back to school through this initiative. Now, in addition to the financial benefits that persons would have derived from it, we wanted to ensure that they were trained in microenterprise, sustainable business, business literacy, and also various social issues and legislation and policies and programs. So that's a built-in training component. And as we speak today, within another week, everyone would have been certified from this training. So I want to thank the staff of the ministry for doing that bit of it. And also I want to thank all those who participated. It was a new initiative and there were many little glitches along the way, but I think overall what we wanted to achieve, which was also targeting women who are in violent situations, lots of them are in that program. So they're benefiting. The mask is just one. So we're going to balloon out into other initiatives that deal with garments and accessories, reusable bags, anything that requires fabric and stitching and sewing. So I'm appealing, as I'm on the program, to anyone out there who would like to access any of these persons who are skilled in sewing. There's a directory that is created of all of these people who would have passed through this program. You can just reach out to us. We will, at some point in time, share that directory publicly. So if people want access to tailors, seamstresses, they have that. If people want access to products, whether it's masks, bags, whatever it is they think they want to have, you have access to that. And this is looking at creating long-term employment for the people. We're also at the point in the business training where they're coming up with proposals, and we're linking them with the Small Business Bureau, IPED, and other institutions where they can have funding and niche markets.
Thank you again, Minister Persaud. As we're on training and entrepreneurship, what are some other training programs that you're going to be offering to women and girls, single parents, different categories we can look forward to?
So the Guyana Women's Leadership Institute is there, and that has been an institute that's been there for a very long time. It's not being utilized for quite a number of years. In fact, I don't think in the last few years there were any programs there. So because I've had some engagement with the institute before, I understand how important it is to have that working. So we're looking at non-traditional areas of employment, but employment that is needed for developing Guyana, a progressive Guyana. So persons will be exposed to various types of cookery and making of dishes so that we can have catering services come out of this. And this is, I know while the focus is on women and girls, we're not excluding men who may want to be part of this, because we understand that families sometimes, especially single ones, may have a single dad or a single mom. So cooking programs, we're also going to be looking at IT programs, videography, photography, video editing. We're also going to be looking at a number of other interesting programs, whether it's something as exciting as interior design, or you want to look at off the wall kind of areas that, you know, a new industry could be formed. We're looking at how we can come up with biodegradable products, like wear products. So I've engaged a number of entities, but I don't want to tell you too much. I want it to be told when it's ongoing and when we are there. So you'll see quite a number of them unfolding from the ministry, and they will all have that built-in training component that I told you about. Because it's one thing to train people, but if they can't run and sustain a business, then, you know, it's frustrating for them. Just giving them the whole package.
Thank you. Now, if we could just step back a little bit, you had mentioned a little earlier in the program about the adoption board. Mm-hmm. Now, I could remember you discussing, you know, the ministry trying to process overdue applications. How mm-hmm. far along are we with that process?
The adoption process deals with local and overseas adoption. The international adoptions would have stopped because we have to be in alignment with the Hague Convention, which we signed on to. Now, we have, with the help of the Attorney General's office, amended that legislation. So that's to go to Parliament. So until that's passed by Parliament, that will have to be on hold. However, the Adoption Board has already started to process cases, and they are doing it in batches of 6 to 8 cases every time they meet. So it's an ongoing process, and I think they've had 2 to 3 meetings since they've been installed. They're actually working beyond the 1 month meeting time that they've been given. So I want to say thank you to them for being very proactive and for, you know, going above and beyond to get to that backlog and keep that moving.
And the public assistance program, can we get an update?
Right. Assistance is something I would say is a sore thing for a lot of people out there. Everybody wants public assistance. And public assistance is open to those with medical conditions, permanent disabilities, chronic illnesses that may preclude them from seeking employment. Maybe it might be a disaster that someone would have undergone, and it might be a mother whose husband died. She has a lot of children. She can't provide. So many areas that would arise to warrant someone receiving public assistance. However, I want to say that public assistance will be permanent for people who have permanent or chronic issues, but it's a temporary thing for those that we can work with to get them financially independent. So that's where we are going with that. So we are going to be looking at the list. We've just installed the Poor Law Commission, headed by Ms. Amanda Richards, and the Board of Guardians, which would be the regional set of persons who are dealing with public assistance. So now it falls within their ambit to scrutinize the list, get people on the list, and those who they think we can transition off through help. In other words, maybe they need training, maybe they need help to start a business, maybe they need something so that they don't become dependent on public assistance. So that's how we're going to look at it. It's going to be a very compassionate, considerate, humane approach to it. But the reality is that the funding that we have for public assistance is finite funding. So before it was 12,000, we have in this quarter increased it to 14,000, and the requests are so overwhelming that the reality is that we cannot get to every request, but we feel that we will be able to help somewhere or the other. If not public assistance, then some one of our programs will capture them. But I want people to know that the boards are now up. The boards, are gazetted and they're up, and they're starting to function as of now. So once that gets underway, the process should become smoother.
All right. Now, before we move on to the new initiatives, I know you have a few that you would like to inform us about. Could you tell us a little bit about the Spotlight initiative?
So Spotlight deals firmly with violence. And the Spotlight initiative is not unique to Guyana. It is already in the Caribbean, it's already across the world. And there are 6 pillars that fall on the Spotlight that deal with various issues that, address violence. And whether it deals with children or adults, the task is linked. We have to look on the Spotlight legislation, policy, regulations. That falls on the pillars 1, 2, and 3. Then there's pillar 4 that deals with services. Then there is pillar 6 that has an overlap with that. And then there's pillar 5 that deals also with legislation and policy. And 6 also deals with CSOs involving community service organizations. So if you realize from all that I've said, it's a multi-sectoral approach to the whole thing that we call violence. So through Spotlight, we will be able to address, review, revamp, or even create new legislation to deal with all of the driving points to violence. Then we'll be looking at policies in the same way. We will also be working hand in hand with our stakeholders, including our international partners of the UN and EU through the various entities. And all of this will be funneled into the ministry's programs. And what are some of the, I'll introduce it right here. I have a plan to restructure, reorganize the ministry so that our delivery of services would be so much better. So I would like to develop a welfare unit at the ministry that deals with all of the issues that I mentioned before, separate that from the probation department, develop a monitoring and evaluation unit, and also look at other areas of staffing and also upgrading to deal with the modern technology, maybe getting tablets out into the community so that our probation officers have them, looking at software to network. So it's a very, very, as you can see, modern approach to how we deliver services. So Spotlight is linked to that, and also linked to the partnership that exists between government and community. Community service organizations would have partnered with government before, but it's strengthening their capacity and utilizing the resources and services which they offer strategically with us. We are partnering with Blossom and ChildLink and Child Advocacy Centers. So one of the initiatives I am working on is to have a parallel to that, the Advocacy Center for people who experience violence or other issues. So when someone comes to that one-stop shop, they can have access to a doctor, a counselor, the survivor advocate, everything, one place. And so by having this model, we will be able to network with the community service organizations, and they'll be trained, they'll be enhanced to provide that support service to what we do. So it's not having pockets of people doing really good work. It's harnessing and garnering the energies and the resources and the funding so that the product is one, and that when we effect delivery, it is exceptionally done. So it's looking at it very comprehensively.
And thank you again, Minister. And what are some of the plans for 2021 as we wrap up?
Well, 2021 will see the movement of many of these things into fruition because we have managed to start a lot of this in the last quarter. Some of these would be in the planning stages, but I would like to see increases in a lot of the things that we deliver to people, and this is where it comes to me in budget to try to make a strong enough case so that we can have increases in a lot of the things that we give to the elderly and those who are dependent on us. And we are also working on our early childhood development program. This is through the Child Care and Protection Agency, so that we work in that gap between the birth of a child to about ages 3 or 4, looking at their psyche, looking at their emotional intelligence, and looking at how we can work with them so that they develop into stronger individuals at every stage and phase. Expansion of our child advocacy centers to all of the regions. We're also looking at actually getting the model that I shared with you out to all of the regions, working with several regions who would have found themselves at the top of the violence indicator, more commonly found in reports where violence occur, so that we have more counselors, more people out there who would be interfacing with communities and people, more cottage industry programs, especially in the hinterland and among the migrant population and those who are trafficked. Trafficking is a very serious issue, and when someone is trafficked is modern day slavery, for want of a better word. So we're working, we started that work just shortly with the police, training all the people who would complement what we do, so that when we go out into these areas, what we do actually has an impact. And working to restore futures and lives that would be severely affected and devastated, decimated, I would say, by instances of trafficking. Also looking at expanding a number of our programs. I'm very big on decentralization because access must be easy for people. Looking at how people can utilize online technology to access our forms, our services, and us. So we've just set up a virtual help desk on Facebook. So I'm going to be working a little harder. So in the new year, I am actually on it. So when people inbox, they're speaking directly to me. So there's access to me. And COVID has severely affected the in-person meetings with ministers and people. I mean, we have to adhere to the COVID protocols, but hopefully next year we can have more of those, and my open door policy is still there. So it is getting us out there. I believe in taking services and the ministry to people. So you'll see a lot of that in 2021.
And one more thing, Minister, before I wrap. You know, I always like to get everything in with you. Frontline Workers, there was a program to assist them, I think, with child care.
So
how is that coming out?
So that's now getting started, Essential Childcare Subsidy. So this is targeting essential and frontline workers, which would include categories such as the security sector, people who are vendors, people who sell in stores, supermarkets, healthcare workers, to name a few of the categories. And this involves us getting our licensed and registered daycares up and ready in adherence to the COVID-19 protocols. We've already worked with 132 of them out of 240. And this would have meant that we would have given $50,000 to each one of these to get themselves ready. We've done training with them. So when someone accesses our service, anyone that falls within the category, they'd have to be within a certain income bracket. They would have to be, of course, vetted to ensure that they fall in the category. And we will pay directly to the licensed registered daycare services for them to place their child or children. They're 7 years and below. Now, to access the service, the applications are online or they're at any of the ministry's locations. And we know and we truly appreciate and applaud the efforts of our frontline workers, especially those who are in healthcare and those who would have been providing security and doing all the things to make our lives go on as normal in a pandemic. So this is our way of helping them through the COVID-19 pandemic and ensuring that they feel comfortable knowing that they have a place that is safe for their children. But I just want to emphasize the daycare centers have to be licensed and registered. So which means we are encouraging people to open daycare centers naturally to benefit from this, but you just have to make sure you're licensed and registered, which means you comply with what we require to be considered a daycare center. So again, it's employment opportunities. So one of the projects, which I wasn't going to tell you, but since you told me, I'm going to, you asked me, I'm going to be working on service care and care providers directory, so which means we'll be training people in all of these care services, care of the elderly, care of children, and well, you'll hear about it.
Well, thank you so much, Minister Persaud, for being on the program Progress Report. We look forward to another episode with you. And let me also thank the listening and viewing public. This has been Progress Report. We were joined by the Minister of Human Services and Social Security, the Honorable Dr. Vindhya Persaud. Have a good day.
Thank you, Stacey. Always a pleasure.
You're welcome. Goodbye for now.